If you have been following our NCLEX trap series, today we are in part 5 or chapter 5, which is the bond phase shift trap. This series is brought to you by the PNG NCLEX Academy. We have an offer to help you pass NCLEX in 90 days by teaching you with question bank patterns, disclosing the common NCLEX traps, how you can avoid them, how to pick the best options even when you're unsure. So if you are interested in that, sign up with us at vpngglobal.com. So many payment bundles, you get to choose which is more convenient for your finances. Let's get into part 5, which is the topic for today. Bond phase shift trap. It's a very problematic trap because bonds look like wounds, so it's natural to think that what is needed here is dressing, pain control, wound care. NCLEX tests whether you can see the invisible timeline. What do I mean? The physiologic priorities of a bond patient, which can change dramatically as they move out of the emergent resuscitation window. The moment a bond patient starts diuresing or showing improved edema, the exam is testing whether you know that the crisis has shifted from fluid rescue to metabolic survival. If you treat the scenario the same way you would at hour 6, where airway and fluid resuscitation is your priority, then you miss the new and more urgent need, which is aggressive nutritional support and metabolic stabilization. And this is why this trap is pretty dangerous. It could lure you as a candidate into choosing sympathetic but low priority options like spiritual support, ADLs, family education, etc., just to name a few, instead of the intervention that can actually reduce mobility and mortality in the next phase. Right? So what do I mean by this this phase? Bone injury triggers a predictable sequence of systemic responses. We discussed this in a class about acid-base imbalance. The first one is the immediate or emergent phase, which is characterized by capillary leak and hypovolemia. And here what's happening is that we have massive capillary permeability, which causes plasma to shift into interstitial spaces. Okay? And the priorities at this phase are airway, breathing, circulation, and rapid fluid resuscitation. Now, the second stage is the transition or diuretic phase. Here, as the capillary integrity restores, it is usually 24 to 48 hours after the injury. Okay, previously third space fluid returns to circulation. And what happens? Urine output increases, which is diuresis. Edema decreases, and vitals stabilize. Then we have the acute flow stage phase, which is basically, the focus here is on hypermetabolism and catabolism. So the bonds produce a sustained hypermetabolic state. Resting energy expenditure rises. Protein breakdown accelerates. Immune function is impaired. And this is the phase where nutritional deficits creates immediate threats to the wound healing and to immune compromise. Okay, and also respiratory muscle strength, etc. NCLEX items that mention diuresis, decreasing edema, stabilizing vitals, those signal that the patient has moved into the flow phase, and the highest physiological priority changes accordingly. So what is NCLEX testing here? 1, can you identify which phase of bone care the patient is in? It could be resuscitative, it could be acute or metabolic phase. Now that you have been able to identify, the second point is, can you shift your priority from restoring intravascular volume to preventing catabolism and supporting their healing? Third, do you know what actions are time sensitive for the new phase? Okay, whether enteral nutrition, glycemic support, early mobility, etc., versus actions that are important but not immediate, like discharge teaching. We've discussed a couple of times that when you spot an NCLEX question, the first thing you have to do is point out what part of this scenario, what part of this step is likely putting the patient's life at risk. And when you have an option, there's sometimes when none of the options are wrong, but some are just more pressing than others. That's exactly the same science we're discussing here. So NCLEX often traps candidates with choices that are reasonable, right? But they are not time critical in the current phase. So the exam wants the intervention that will mitigate the most immediate physiologic threats for the phase that has been described. Now, what are some confusions you might have? Oh, the emergency is over, so psychosocial care or education should come first. No. While psychosocial support and teaching is vital, it's not the physiologic priority when the patient is facing a hypermetabolic, risk that would impair their healing and their immune response. Would you pick wound care or dressing changes? No. Wound care is important, but until metabolism needs are met, tissue repair is compromised. So enteral feeding and protein calorie delivery support wound healing more fundamentally in this phase. The option might tell you, are you supposed to start formal rehab immediately? Early mobility is beneficial, but energy delivery has to be ensured first. Exhausted catabolic patients, they cannot participate meaningfully without nutritional support. What if the option tells you parenteral nutrition is always better than enteral? Listen, enteral nutrition is preferred when the gut works. It preserves gut integrity and it reduces infection risk associated with central lines. So parenteral is for specific contraindications. So when the stem tells you that the patient is diuresing, vital stabilizing, urine output increasing, edema decreasing, what do you have to do? First of all, make nutrition urgent. Early enteral feeding will prevent muscles wasting and it will also support their immune function. So if the bowel sounds are present post-resuscitation, initiate enteral feeds as soon as tolerated. Secondly, you need to address hypermetabolism and glycemic control. You need to monitor glucose, anticipate increased insulin needs, because uncontrolled hyperglycemia can worsen infection risk and healing. Third, you need to continue electrolyte monitoring, because diuresis will alter electrolytes and this can unmask imbalances, so you need to replace as indicated. Fourth, you can plan staged wound management, not premature advanced therapies, okay? Negative pressure therapy, grafting, compression, those may be phase appropriate, but they depend on metabolic stabilization and infection control. That brings us to the next point. You need to prioritize infection surveillance, because with immune suppression and open wounds, infection control is always a high priority. The sixth one is to coordinate early rehab once metabolic needs are supported. So physical therapy, mobility, splinting, they can help prevent contractures, but they are more effective when the client is nutritionally optimized, okay? So some NCLEX distractors could be that offering psychosocial intervention, choosing comfort measures, picking ambulance assistance as immediate priority, or recommending delaying nutrition until later. These are all plausible answers, and that's why they're effective distractors. The correct choice will protect the physiologic process that matters most in the current phase, okay? So when you read a burn stem, you need to run your rapid mental checklist. Has the patient transitioned from resuscitation to diuresis and flow? If yes, ask, what kills this patient fastest now? What intervention can reverse that threat the fastest? And then you eliminate answers that are supportive, but they are not critical at that phase. Okay, I hope this makes so much sense. And you should know that when a burn patient is diuresing and the vital stabilize, nutrition becomes your emergency. You need to treat the hypermetabolic state before you treat comfort or routine education. I think I have sufficiently explained the fifth trap of NCLEX, and if you found this helpful, imagine learning every single system this way, organizing by question bank patterns and traps, not just textbook information. So at VPNG NCLEX Academy, we don't just review content. We teach you to recognize traps, prioritize like NCLEX, and think in safety hierarchies. So if you're serious about passing NCLEX the first time, We are ensuring you that we can help you pass NCLEX in as little as 3 months. The best part is that our routine is cyclical. At the end of the 3 months, we start afresh for another 3 months, all through the year, all through the other years. So visit our website, vpngglobal.com, and get enrolled. Subscribe to this channel, turn on post notifications. See you at the next NCLEX tip.